Kshemendra, let's go over to you at VA. You've been over there for a little while now as the Chief Data Officer, and we all know a lot of this is about the data and making sure we have accurate data and making sure we can identify it, index it, et cetera. Give us a state of the state as to what's happening over there at VA as you've entered onto the scene.
Thanks, Luke. I will, and appreciate being on the show. And I really want to riff on what Jose and Mark mentioned earlier. Jose is a great partner over at HHS. We're also building a common operating platform, leveraging some of the lessons learned and working out appropriate sharing of data. We report into HHS Protect, our testing. I think all of you know, but maybe the audience may not know, VA runs the largest integrated healthcare system in the United States. So in that role, we're reporting into Protect now as we're building out a common operating picture to help the executives in headquarters and in the field with the integrated networks, with the medical centers out in the country to better align decision making and support our veterans, and to help us execute our fourth mission of helping to backstop the U.S. healthcare system in this time of pandemic. Also coming back to what Mark was saying about interoperability, access, APIs, aligning with standards-based approaches. We're all in on that, and VA kind of sees ourselves as a key test bed, a key partner for the national coordinator. We've been a leader in doing health information exchanges and things like that. The Blue Button work, for example, started at VA, now has migrated over to CMS. Something I want to highlight, though, is the policy framework. I came in, like you said, about 11 months ago. Been doing a lot of work with partners inside of VA. What's interesting is that CDOs are in all different parts of organizations. Jose is the CIO, he's also the Chief Data Officer. At VA, I'm not in the Office of the Information and Technology. I'm in the Office of Enterprise Integration, which has an internal integrative policy governance function across all of VA. I partner closely with the CTO, Charles Worthington, and somebody in a new role, a Chief Data Technology Officer, Denise Kitts. We work with the CIO, with the executives and the different operating components within VA to drive an integrated data strategy using a data governance council. Some specific examples. I talked about the common operating picture. We're building that to help us improve our response on the COVID-19. Telemedicine is another area. We've been a leader in telemedicine, but over the time of the pandemic, that's just gone off the charts in terms of how much of our service delivery to veterans has been done through telemedicine, tele-ICU, things like that. We're also kind of at the cutting edge of disease modeling. The national surveillance tool. We've developed epidemiological models of COVID-19 and how it manifests. We use natural language processing on the clinical notes in our electronic health record system to be able to generate that signal to allow us to understand the patient journey, inpatient and outpatient, for the veterans we serve predominantly through the Veterans Health Administration. So a variety of different aspects, and while data has been a strategic asset in VA for some time, the push now is with the Foundations of Evidence-Based Policymaking Act, the Federal Data Strategy, to really take that to the next level. And there's a lot of energy behind,
using the data